Well, I want to welcome everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging. We do these webinars. I do these webinars through a funding from the Texas Department of Health and Human Services. And we're thrilled to partner with Melinda Gardner today with the Area Agency on Aging, who's going to talk to us about Medicare. And this is a start of kind of a new thing for me, although Melinda's been doing this for a while. We've partnered to do the Medicare Mondays. And so we'll be doing these every Monday for the foreseeable future. And we'll be looking at some different topics. And being that we're in open enrollment, in the midst of open enrollment, today Melinda's going to talk to us about the Plan Finder and the Medicare open enrollment scams that are prevalent this time of year, and we want to make sure you're aware of them. So, Melinda, I'm going to turn it over to you.
All right. Thank you very much, Marty. And again, thank you everyone for joining us today. We have people from all over, even from out of Texas. And so we welcome you. And if you do have any questions, feel free to put those in the Q&A, or if you have any suggestions for additional topics, feel free to put those in the chat so that we can make sure and get the information that people are looking for. All right, so as Marty mentioned, today we are going to talk about Medicare gov, which is the official Medicare website. Also, we're going to go over Plan Finder and then give you some information on scams that are more prevalent during this time. And my clicker worked before. Hopefully it'll work now. All right. I am Melinda Gardner, and I am a benefits counselor with the North Central Texas Area Agency on Aging. And I am also program coordinator for the Texas Senior Medicare Patrol. It's hard to talk about Medicare without talking about Senior Medicare Patrol. And I'll give you a little bit more information about that shortly. As a benefits counselor, we do help people understand Medicare as well as other government benefits. And we are a part of SHIP, the State Health Insurance Assistance Program. So let me share with you what that is. And I have to make sure and have my sound on. Okay. Okay, so my video is not working. Let's see.
If you want, you could pull it up on your screen and then reshare and then reshare back if that works for you. If you know what I mean.
Okay.
Not doing it within your PowerPoint.
Okay. Let's see how that works.
Will it work, Kelly?
Are you still seeing my screen or no?
I'm seeing you now.
Okay.
You've unshared.
Okay. Great. Okay, that's what I was trying to do. Hold on.
I did. You want me to try to pull it? Let me.
Yeah, I'm not sure if it was saved.
Oh.
Sorry for the delay.
Let me just see what we're.
Okay, I'm gonna have to. Okay.
Huh.
No. Okay.
I'm sorry. Yeah, I'm not showing the.
Yeah, it's not coming up as a video, so.
Yeah, I'm
that's
not getting.
All right. Okay.
Sorry.
I should have checked that one. Okay, I'm going to pull up the share again. Okay, so it was a very short video about what SHIP is. SHIP provides unbiased information, and it is confidential assistance about Medicare to the beneficiaries, their family members, and caregivers. SHIPs are located throughout the United States, and so anywhere that you live, you can contact SHIP and be able to get confidential, unbiased information. All right, so today is our first Medicare Monday. It is going to be a series for through next year, or at least the middle of next year. And in addition to today, November, we will be talking about Medicare Advantage plan and prescription drug plans, as well as additional scam information. And then we will, in December, talk about current topics and have information on the 12 holiday scams, the countdown. All right. Okay, now my other screen's not coming up. Okay, there we go. You are at the 10 a.m. live session. This afternoon will be recorded, so it'll be the same session, but there will be live Q&A. So we'll be available to answer questions. All right, the Texas Senior Medicare Patrol. That is the program to empower and assist Medicare beneficiaries, their families, caregivers, to protect, detect, and report healthcare fraud. Why is this important? Because the community is our best defense against scams. It's hard for Medicare or the IRS or Social Security to be out in the community. So it's up to us as consumers to review the information, our Medicare summary notice or our explanation of benefits, to see if there are any errors on there. And so it's important to note what it is, and we'll talk a little bit more about that as well. There is the hotline on here if you do suspect any type of Medicare fraud, error, or abuse. You can contact the Texas Senior Medicare Patrol. If you are outside of Texas, then there is another number for you to contact, and we'll go over that also. So today, we are going to review Medicare basics before we get into Medicare.gov and Plan Finder. We want to make sure people understand what they have, whether it be Medicare or Medicare Advantage. So when you first enroll in Medicare and certain other times, you can choose how you get your Medicare coverage. There are two main choices: Original Medicare and Medicare Advantage. On page 6, I believe it is, of the Medicare and You handbook, it was in the 2021 book. 2022 has already come out. I believe it's either page 5 or 6. Original Medicare is Part A and B. That's federal government insurance. Part A is hospital coverage. Part B is medical coverage. Original Medicare does not cover all costs, and it doesn't cover most prescription drug coverage. Therefore, a person can add Part D in order to have prescription drug coverage, and they can add a supplemental coverage. Supplemental coverage includes Medigap, or you may have a former employer insurance or retiree coverage, or you may have a Medicaid program that covers the out-of-pocket costs. Now, in order to have Medicaid that covers out-of-pocket costs, you do need limited income and resources. If you do have questions about that, feel free to reach out to us. That is one option for Medicare. Once you have Part A and B, then you can get Part C, which is a Medicare Advantage plan. It's an all-in-one bundled plan where you get Part A benefits, Part B benefits, and most of the time, Part D benefits. The Advantage plans provide some extra benefits, such as dental, vision, hearing, sometimes transportation, fitness programs, over-the-counter prescription, over-the-counter assistance with some medications. So those extra benefits, they do not have to provide because those are benefits that Medicare normally would not provide. So it's important to compare plans to make sure you're getting the benefits that you want. Some plans also include lower out-of-pocket costs. It depends, again, on the plan. It is recommended each year to review your plan to make sure you're in the plan that works best for you. Note at the bottom, okay, Medicare supplement insurance policies only work with original Medicare. They do not work with an Advantage plan. So you cannot have an Advantage plan and a supplement insurance. This is a chart of the Medigap plan coverage. And in the Medicare and You 2022, it is on page 76. And it shows what the Medigap policies will cover after Medicare pays. These are 10 standardized policies. And if it says 100%, that means it covers everything after Medicare pays. As you can see, each plan letter has different plan benefits. So when you are talking with insurance companies, make sure you know which plan letter they're quoting you coverage for. So that way you can compare apples to apples. Medicare.gov. We're going to talk about what you can do on Medicare.gov. This is the official website for Medicare to find out information. You can search for information. You can create an account if you are on Part A and or Part B and be able to view your claims and other things on the website. This is the actual, how the website looks right now. And you have basics up at the top, health and drug plans, providers and services, and an option to log in. You can also preview 2022 health and drug plans, or if you're new to Medicare, if you click on preview 2022 health and drug plans, you will be able to go look at the rest of 2021 as well if you're just starting Medicare. And then you do have the option here to log in or create an account if you do not have one yet. In order to compare plans, you would click on Preview 2022 Health and Drug Plans. And at this point, it does allow you an opportunity to log in, create an account, or continue without logging in. So if you are not on Medicare, you still can compare plans. You will have to enter your prescription information, your zip code, and your pharmacy information, and it does not save that information. If you have an account, it will save that information. You will not have to re-enter it. So once you're here, you can find a Medicare drug plan or Medicare Advantage plan. So if we look at this sheet, explains what you can do once you create an account. It allows a more personalized search so that you're able to compare plans based on maybe what you currently have. It will allow you to save your drug list and see prices based on any help you may get with your drug costs. You will need your Medicare number, of course, last name, date of birth, zip code, and your Part A and Part B effective date. You will create a username and password, so it's important to keep that username and password so that you can log back in, but there is a way to find your username if you're not sure of what it was, and to reset your password. Here is information about basics. That was one of the options at the top on the Medicare website. You can get started and learn about Medicare. You can see what the Medicare cost would be, and that's estimated cost. You can also find out your rights under Medicare and information about identity theft and fraud to protect yourself. There's also resources available on the Medicare website. You can talk to someone. There is a live chat. If you're looking for forms or other resources, that is available. You can request a Medicare and You handbook. And there's information on advanced directives and long-term care. And we are able to assist with preparing advanced directives. If you do not have those available, that will be one of our Medicare Monday topics at a later time. Under health and drug plans, this is where you can find health and drug plans and compare your coverage options. Find a Medicare supplement insurance, which is a Medigap policy. You can get started with the health and drug plans. You can learn more about them, which you can find out approximate costs, what they cover, how they work with other coverage, and you can find out about Part D drug coverage. And then under providers and suppliers, it does have information on finding care providers, Medicare durable medical equipment and supplies. You can compare procedure costs. So if you have a procedure code, you can put that in to find out what some of those costs are. Under providers and services, it will also explain what Medicare covers, and you can find information on claims and appeals. Once a person logs in, this is what it will look like. It will have a person's name at the top, so that way you know you're logged in. Messages, if you have received a message from Medicare electronically, it will show up under messages. Live chat is available so that you can get your questions answered right then. You can log out at this point if you're all through with researching or comparing plans. And then if you need Spanish translation, you can easily change the website to Spanish. Under name, it does give you information where you can make changes to your account. You can download claims. You can see what your premium is. If you are not collecting Social Security, then Medicare requires 3 months, a quarterly payment for your Medicare premium. However, If you have a Medicare account and you want to pay your premium electronically, you are able to pay your premium monthly. So that is a benefit, and it's a new benefit that's available for people who are not collecting Social Security yet. If a person is collecting Social Security, that's automatically deducted from the Social Security benefit. You can also find out what plan you have if you do have a Medicare Advantage plan or prescription drug plan. Find out what preventive services you've already had, who your providers are, and then look at your saved drug and pharmacy list. And we're going to look at that shortly. This is the information that is provided under account information. It shows what your current plan is, and it shows the coverage start date for Part A and Part B. Another good thing about having an account on Medicare.gov, you can actually print your Medicare card right from the website. If you're logged in, you can also, this is where you can compare plans once you're logged in. It shows what your coverage is, and then if you are receiving extra help, it will show that as well. And then what type of coverage are you looking for? You can compare, you can find out options for Medicare. So if you want to learn more, you can do that. If you want to find out about Medicare Advantage plans, Part D, prescription drug plan with a Medigap policy, or just a Medigap policy. Now, I do have to note, open enrollment has started, but that does not apply to the Medigap policy. And I'll explain that in a little bit. So here is where you can make changes to your account settings. If you want to receive the handbook electronically, you can select that here, as well as your Medicare summary notices. You can also verify your email address so that if you are receiving any type of communication via email, make sure that is the correct address on there. And then the options we've already talked about: printing your Medicare card, paying your premium. Oh, the new one, you can actually manage your representatives from the Medicare website. So if you have individuals who you want to speak on your behalf, you can enter their information here, and that way Medicare can see that you have authorized them to speak on your behalf. And if there are any publications that you would like to order, you can order directly from the website. All right, Medicare open enrollment has started on Friday, and it goes through December 7th. This is the time of year when individuals can join, switch, or drop a prescription drug coverage plan. Now that means it's either a Part D standalone prescription drug plan or a Part C Medicare Advantage plan that has prescription drug coverage. So that's what this open enrollment period is for. It does not apply to the Medicare supplemental insurance or Medigap policy. A person can apply any time for a Medigap policy, but if they are not new to Medicare, then the application will go through underwriting. So keep that in mind as we are in open enrollment for prescription drug coverage. Now, what I'm going to have to do is pull up this video separately. Jennifer Salazar, who is the director of the Texas Senior Medicare Patrol, wanted to be here with us today, but she could not. So she did record some information for us, and I will have that requeued at the end so that we can get information on open enrollment scams. All right, now we're going to talk about Medicare Plan Finder. This is how you can get estimated costs and compare plans for the open enrollment period. And even outside of open enrollment, you can compare plans, especially if someone's new to Medicare, if they're losing employer coverage, they can still compare plans on Medicare.gov. So if a person is logged into their account on Medicare.gov, they can navigate to their Save Drug and Pharmacy list by going to Account and My Information. This is what that looks like, where it shows your saved drug list, it shows your prescriptions, it shows how it's packaged, the quantity, and the frequency of the refills. That's important because if you don't have the correct frequency, the cost may not be accurate. So it's important to get as close as possible to what you actually, how you actually refill your prescriptions in order to get the best estimate. On the right side of the screen is the pharmacy list. A person is able to put up to 5 pharmacies in order to compare costs, and we'll see why that's important in a moment. And then you can start a new plan search. So here this talks about in-network pharmacies. In-network pharmacies usually allows the person to have a lower drug cost because it is a in-network pharmacy. And so if you are looking for an in-network pharmacy, you're able to find that on the website. If you look on the right side of the screen, it shows several prescriptions. It shows the pharmacy. As you see, Walgreens is out of network. Mail order is a standard in-network pharmacy. Walmart is a preferred in-network pharmacy. Now, this is for a particular plan, so that's not always the case. This is a particular plan that we're looking at. So if we look at the yearly cost by pharmacy, it shows that this first prescription at Walgreens out of network is $270. This is the yearly cost. The mail order, which is a standard in-network pharmacy, is $70. Excuse me. And Walmart is a preferred pharmacy, and the prescription is $60. So as you can see, the type of pharmacy does matter, and it depends on the plan. And if we look toward the bottom, the estimated total drug and premium cost, this is for all of the prescriptions. It's about the same for all of these pharmacies, which is interesting since Walgreens is an out-of-network pharmacy. If we look at the second prescription, the second prescription, that's even a higher cost out of network, $320 versus $120 and $130. So it is important to compare plans so that you can see what those costs are based on the plans that you are looking at. If any of you have done a plan comparison before, this is what it looked like once you selected compare plans. It would show how many plans are available, 17 Medicare Advantage plans available, and then it would start listing plans. If you wanted to do some type of filtering, you would have to click on this filter here and then select your filters. The new look actually has the filters more visible, and it is sectioned out. So you can filter by plan benefit, such as dental, vision, hearing, transportation, fitness programs. So you can select that if you are looking for those particular benefits. You can also select by insurance carriers. Drug coverage. This is set to show all plans, whether they have drug coverage or not. And so if you are looking for a plan with drug coverage, it's important to select includes drug coverage. Star rating. If you only want plans with certain ratings, then you can select that. And if you're looking for a plan that is a special needs plan, such as someone with chronic conditions, someone in a nursing facility, or someone that has Medicare and Medicaid, then you can select special needs plans. And those types of plans coordinate care better for individuals. The comparison is sorted by lowest drug and premium cost. If you want to sort it differently, you can do that where it says sort plans by. Most people are concerned about their prescription drug costs. This is the old way of how the comparison looked. When you're looking at up to three plans side by side, this is how it looked, and it was very confusing and not well formatted. The new look is a cleaner look, and you're able to see the information clearly. So it does show the plan itself, whether it's an HMO or a PPO. This particular screenshot is all HMO plans, but PPOs are still available. You can request enrollment right on the website, and you can look at plan details, further information about the plans. You'll also note that it shows the monthly premium, and this is in addition to the Medicare premium. If we look further down, it shows health premium and drug premium. If we look at the second plan, Care First, Blue Cross Blue Shield Advantage Core, HMO, it shows the health premium is $20. The drug premium is $15. Here at the top shows $35. So that's the total monthly premium. If someone is receiving extra help with their prescription costs, that extra help will only cover some or all of the drug premium. It will not cover the health plan premium. So keep that in mind if you're assisting someone, if you're comparing plans, and you wonder why there may be a cost for the plan if you're on extra help, that could be the reason why. So we see the overview has the star rating. It has if there's a health deductible or a drug plan deductible. It also shows the maximum you pay out of pocket. So that's a yearly maximum out of pocket, and that runs by calendar year. It also shows the Part B premium, and then plan features are underneath that information, and there is a list, and you can select more to see the rest of those. And here they are here. And this shows the benefits and costs on the right side, primary doctor visits, specialists, tests, labs, radiology, x-rays, and so on. And it provides those costs so that a person can easily compare those costs to see if that plan works best for them. All right, this is also the new print styling, and so it is a little cleaner. Even though it is a lot of information, it provides a person more detail so that they're able to make a determination. If you look at the plan features, it does show an X where there are no features. Those features are not available for that particular plan. So it's important to know what benefits you're looking for so that you can compare plans that work best for you. This is also a new look. Once you go into the plan, it does show what you'll pay for your monthly premium, your health deductible, your primary doctor visits, and your prescription drug costs for the year. And that does not include the monthly premium, if there is one, for the prescription drug plan. This is some more of the comparison tables showing the pharmacies. There are 2 standard pharmacies and an out-of-network pharmacy. Again, looking at the cost, they are higher with the out-of-network pharmacy. And this also shows if a person will meet their deductible in 2021. Now, based on these costs, I would think they would meet the deductible. So since this was a test website, it may not have been working when they did this screenshot. And then below that, it shows the estimated total monthly drug cost. So you can see it by month, what a person would be paying for the prescriptions that they're on. All right, this is some more, the print styling has changed. It's not as many sheets required to print the comparison, and it is better formatted so that it reads a lot better and easier for individuals. Also, in the Medicare gov plan finder, there is information on pharmaceutical assistance programs. So if someone has high prescription costs and they're looking to lower their costs, they can enter the prescription in here and see if there is something that will help them reduce their costs. Sometimes it's government programs, sometimes it's the pharmaceutical assistance program. So it's good to have that here in one place where someone can actually look up that information. And there are some state pharmaceutical assistance programs. Texas does not have many. This is different than the previous screen, these assistance programs. State assistance programs are a little different, and we have a couple, maybe 3 in Texas, but not many, but they are available. And then PACE programs are available for people who need nursing type care at home. And those PACE programs, unfortunately, are not available in the North Central Texas area, but there are parts of Texas that do have PACE programs. And that helps individuals stay in their home versus going to a nursing facility. So here are some of the updates that were done to the Medicare Plan Finder. New drugs were added for the insulin savings model. If anyone is taking any diabetic medication or insulin, That used to be pretty expensive and unaffordable for some people. And so this insulin savings model was developed last year, where individuals could get prescriptions for about $35. And so they've added additional insulin prescriptions to that model. So that has reduced the cost for those prescriptions. Plans can now specify pricing for the 30, 60, or 90-day refills. It's a good idea when you're comparing plans to do everything 30 days to get a ballpark cost, and then change it to the 60 or 90-day refill depending on what your preference is or how you're getting your prescriptions. And then you can also choose the pharmacy type that the pricing applies to. Again, in-network, standard, preferred, those types of pharmacy types. Addition of a preferred specialty tier for those high-cost drugs, so that has been added. And then they did some tweaking to the questions for special enrollment periods. As mentioned earlier, it's important to review plans each year. You have to look at the cost, what the premium is, and versus what a person's budget is. The deductible, copay, and coinsurance, those are all part of the cost. Out-of-pocket costs, are they in line with, what you want to pay or what you think you should be paying? Out-of-pocket yearly limits, that's a cost to keep in mind. And then you also, it's important to look at the coverage. Does it cover all healthcare services that you need or that you use? Does it cover your doctors and other health providers in that plan's network, or do they accept the terms and coverage? Coverage for prescription medications, is it on the plan's formulary? If it's not on the formulary, you could be paying full cost for those prescriptions. And do you have enough coverage for your changing healthcare needs? You have to think about what's going to happen down the road. Do you have the coverage that you need? And if you have other coverage, does it work well? Does it work well with that other coverage? Or is it something that will replace that coverage? And then, is it convenient? Are your doctors and providers and pharmacies easy to get to? Is it easy to order refills of your medications? Can you receive the refills by mail? Is that something that's important to you where you don't have to go to the pharmacy? Online information and services that you can easily access if you are using online. And then, are you comfortable with the amount and type of paperwork you need to do with regard to your medical bills and the plan? Some plans may require having more paperwork than other plans. All right, before we get into the question and answer, actually, Marty, if we could take a look at the chat and see if there are any questions while I pull up the
I looked
video.
a little bit, and I did primarily comments.
Okay.
And there were a few comments about the slides being blurry and that kind of thing, but we'll talk about that afterwards and see if we can do that. But that was primarily what I saw. I didn't see really any questions.
Okay. All right. Wonderful. All right. Well, I'm going to pull up the video.
One person asked where they would get a copy of the this year's the Medicare, what was the handbook? And so I'm assuming that they get that under the documents that you pointed out when they log into their portal.
The handbook or the slides?
The handbook. You mentioned the handbook, the 2021 and 2022 handbooks, and someone was asking where they would get that.
We can send them out. So if someone wants to reach out to me, I can definitely send that out with a mailing address. And I do have my contact information on the next slide as well. And let me pull that up here. I'm not sure why it's not coming through. I'm going to have to close out that one and then open up another one. Bear with me one moment. Okay, it doesn't like that.
I was able to get the other one to run. Do you want me to see if I can get it to run here? Are you talking about the?
Okay.
Go ahead.
I got it. There we go.
No problem. Nice.
Okay. All right. I think this is going to work. If it will allow me to share my screen again. Okay, there we go. All right. As I mentioned, Jennifer Salazar wanted to be with us today, but could not. So I am going to she provided information on open enrollment scams, even though these scams do happen at other times of the year, they seem to be more prevalent during open enrollment. So let's listen and take a look.
Hello, everyone. My name is Jennifer Salazar with the Texas Senior Medicare Patrol, and it is my pleasure to co-present with the fabulous Melinda Gardner today. Today, we're going to talk about Medicare open enrollment, and I don't know about you, but Medicare open enrollment is so overwhelming. And to make matters even worse, scammers follow the headlines, and scammers know about open enrollment, and they're going to try to get your money. And guess what? Your Medicare number is money to scammers. And the biggest thing right now in the news, and it has changed our whole life, and it changed open enrollment last year, and it's changing it this year, is COVID-19. And this is what we saw last year, and we expect to see it this year. An increase in telephone calls, the potential for increase in doctor's offices with advertisements of Advantage plans and Medicare Part D plans, and finally, on social media platforms, advertisements for plans custom tailored to the person looking at it. But what we tell folks is be vigilant, do your homework, don't take the easy way out. If you see something and you think, oh, I can sign up on, social media for a plan, don't do it. It might be easy, but guess what? You will end up in the wrong plan, and you might not even end up in a plan. It could turn into identity theft. The biggest thing we see during Medicare open enrollment and non-open enrollment is scammers will lie. Scammers will call you pretending to be Medicare, Social Security, even the IRS. And in their caller ID, they spoof the phone number, which means they change the phone number in the caller ID box and the name. So if you get a phone call and if it says Medicare, and when you talk to them, if they ask for your Medicare number, guess what? It's not Medicare. Medicare will never call you on the phone. You'll get a call from the king himself, Elvis, before you get a call from Medicare, because it's not going to happen, especially during Medicare open enrollment. Some other scams that we see is you'll receive a phone call offering you a health plan for only $299. It'll cover all your prescriptions, all your doctors, even over-the-counter medicine. Wrong. Guess what? If it sounds too good to be true, it's probably a scam. or you get a phone call because you have a reward from last year. You didn't spend all your premiums, so you get money back. Again, wrong. Or the worst one is an agent tries to sign you up for a plan that isn't right for you. If you do meet with a Medicare Advantage agent, an insurance agent, a Part D agent, you have to show your prescription drugs. You have to discuss your doctors in some cases. If they don't ask for any of that and they put you in a plan, that's a big red flag, because you've got to have that in order to enroll in a plan to know what your expenses will be. But some other things that we see, watch out for what we call fake RX cards. There are legitimate RX discount cards out there, yes. In fact, in my wallet, I have a Walgreens card, a Kroger card, a CVS card, because I want my points, right? Those are legitimate. But there are some businesses that have cards that are not legitimate because they're scammers. When in doubt, check it out. Give us a call. Also, you need to watch out for anybody that calls you about a big discount on a new healthcare plan. Too good to be true. And the biggest thing is, remember, healthcare plans cannot call you over the phone unless you give them written permission. They cannot call you. They cannot call you. They can mail you things in the mail. That is legal. They can mail you things in the mail, but they cannot call you out of the blue, period. In fact, every single year, Medicare wants to protect its beneficiaries, and people that are insurance agents, Medicare Advantage agents, have to take training, and there are certain rules they have to follow under Medicare. And Melinda is so sweet, she's going to email this list out to every one of you so you can stay safe. And why do they want your Medicare information? Why do they want to sign you up for a plan when they're not really going to sign you up for a plan? Easy. Money. They want your Medicare number because a Medicare number is worth at least $30,000, but not to you, to a scammer. And not only that, they can commit identity theft. So how do we stop Medicare open enrollment scams? I'm glad you asked. First off, Medicare will never, ever, ever, ever call you on the phone. Remember, the Queen of England will call you first before Medicare. Number 2, guard your card like a credit card because it's worth so much more. Number 3, don't give out your Medicare card to anyone but your doctor at your doctor's office. Also, don't let anyone push you into making a fast decision. You have from October 15th through December 7th to make a good decision on the enrollment that you want, the enrollment plan for Medicare Part D that you want. If you receive a call you don't recognize, don't pick up the phone, let it go to voicemail, or if you do answer it, if they ask for any of your information, hang up the phone. Remember, it's okay to be rude. These guys are criminals. And finally, know you have options. Medicare open enrollment can be overwhelming, but there are experts to help you at no cost to you because of grants. And you are all very lucky because in your area, if you are in the Arlington area, you have Melinda Gardner with the Area Agency on Aging and her team to help you. But if you are in the state of Texas, you can contact your local Area Agency on Aging and they can help you with enrollment plans. And if you ever need to contact the Texas Senior Medicare Patrol, our toll-free number is 1-888-341-6187. Stay safe.
All right. Jennifer mentioned the Medicare marketing violations. I am going to send that out to Marty so that it can be sent with the recording, so individuals will have that. Right. And there are some other, if anyone has any questions at all, you know, they can feel free to reach out to us because there are many publications that are available through Medicare, through the Texas Senior Medicare Patrol to help people just keep track of things. We have a healthcare journal that we provide to individuals so they can keep track of their doctor's appointments. We have a publication where individuals can record their insurance agent information so that whenever they have questions, you know, they know who to talk to, because sometimes we get calls from individuals and they say, oh, someone called me, but I don't know who it was. This way they can record it and make sure to have the information as far as what plan they're in and things like that. So we are here to help in any way we can. We do get funding from the federal and state government in order to help people, so there's no cost to individuals. Thank you, Marty.
Sure. Anybody? I see that. I think we've got somebody's got something here. Explain zero payment Medicare, please.
Zero payment Medicare. I may need some more information on that. If someone does not have a monthly Medicare premium, that could mean that they are getting assistance from the state with paying their Medicare premium. And so therefore they would not have a monthly cost for Part B. But I'm not sure if that's what.
Would that be the extra help?
That would be the Medicare Savings Program. That's a state program, which is different from Extra Help, which is a federal program. The federal program helps with prescription costs. The state program helps with Medicare costs. Medicare Advantage premiums are zero pay. Okay, right. Okay, Medicare Advantage plans, sometimes they have a monthly premium, sometimes they do not. In the back of the Medicare and You Handbook, there is a listing of all the Texas Advantage plans and all the Texas prescription drug plans. And a lot of the plans do not have an additional monthly premium for Advantage plans. As long as you're paying your Medicare premium, then you may not have an Advantage plan premium. But that does not mean it's the best plan for an individual just because it is a zero monthly premium. So it's good to compare plans to make sure, and then also to speak with the doctor or providers that that person goes to, because you have to make sure that the providers accept the Advantage plan. They have their own network. HMO plans, a person has to stay within network. PPO plans, a person is allowed to go outside the network, but they may have higher copays.
And Bree asks, is it possible to get Extra Help and state program together?
Yes, it is possible to have both Extra Help and the Medicare Savings Program. In order to apply for the Medicare Savings Programs, we can assist, but individuals can apply online at yourtexasbenefits.com. I was going to put that in the chat. And also for the Extra Help, a person can apply at ssa.gov. So with Extra Help, it is a federal program where a person can live anywhere in the United States and still be able to get Extra Help, or low income subsidy is what it's called. If a person moves from an area, say someone lives in Texas and they move to Oklahoma, then the Medicare Savings Program, since it is a state program, they would have to apply for it in that state. And it varies from state to state. So the Medicare Savings Program, or it's a Medicaid program. So those programs, a person has to apply whenever they move from state to state. The low income subsidy or Extra Help is a federal program, and it's available anywhere. A person doesn't have to reapply, but with both programs, they do have to recertify, and usually that is an annual recertification.
I don't know if you're able to read Debbie Austin's, I believe she's just commenting on there. Are you able to see those, Melinda?
The Social Security website, you're asked to create an app to enroll in Medicare Part B. In order to enroll in Part B, since a lot of the Social Security offices may still be working remotely, you can apply online. So you have to create an account to request enrollment in Part B. I believe that's what she's referring to. They may have an option through a mobile app in order to enroll in Part B. I have not used the mobile app, so I'm not sure how that works. But on SSA.gov, if you create an account, you're able to request enrollment in Part A and or Part B. With Social Security Administration press releasing a 5% COLA for 2022, can we expect income guidelines increasing as much for MSP, or can we expect to see an influx of beneficiaries losing their MSP due to the COLA? Okay, these are all good questions. As far as the Medicare Savings Program, sometimes what happens is people do receive a letter, possibly saying that they may not be no longer eligible because the Medicare Savings Program amounts, income limits, usually don't change until around April. And so it looks like that they may not be eligible, but it's important for them to reapply so that they can maintain that help that they're getting. So there should be a correlation between the increase in the Social Security and the Medicare Savings Program, but because of the time frames, sometimes that seamlessly does not happen. So if someone does have a situation, they're welcome to give us a call and we can kind of walk them through that. Usually if the Social Security income does increase, the Medicare premium increases as well. Hopefully it won't be to the point where it is taking all of the Social Security increase.
Someone commented about Walmart and Sam's are the same corporate, are RX at Sam's covered?
Sam's Club does have a pharmacy, so you can get prescriptions there. They're listed separately on the Medicare.gov website, so that means the cost could be different at Sam's. Even though Walmart and Sam's are the same, their costs could be different.
I think that's everything. I think we've got.
What was the name of the state savings program? Medicare Savings Program. So the Medicare Savings Program is a Medicaid program or a state program that helps with the Medicare premium. Some people may be eligible for a certain level that helps with deductibles and copays as well. But that program does help with the Medicare premium.
Melinda, did you want to advance the slide so they have your contact information in case they want to, well, I guess you want to talk about next month real quick?
Yes, as I mentioned earlier, we are going to be talking about Medicare Advantage and prescription drug coverage in more detail in November. And then we're going to give you information on the current topics for 2022, as well as the top 12 holiday scams countdown. So you can register for the 10 a.m. or the 3 p.m. session. and we still will be doing live Q&A for both sessions. And Marty, you'll explain the registration?
Yeah, I'll be sending out a follow-up email, and the follow-up email will have the link to the flyer for next month, which will have the link for registration. And so you'll be able to just go back on and register for the morning or afternoon session. I know on the flyer, I put some misleading information. I didn't realize we could not do a series of events with 2 events on the same day. So we will have a different login information from the morning session and the afternoon session. If you don't know which one you want to, if you're not sure which one you want to participate in, you're more than welcome to register for both of them, and then you'll get both the morning and afternoon link. But that's up to you. And so I'll be sending that in a follow-up email along with the information that Melinda just talked about that she was going to be getting for you all, and I'll also have the link to the recording for today and the link to the slides to download the slides, which most of you should have by now, but all of those will go out in the follow-up email. And here you have all Melinda's contact information.
Right. And for those of you that are outside of Texas, this smpresource.org is the national website for the Senior Medicare Patrol. So you can go to SMP Resource, and then you select your state, and it will give you the information for your particular Senior Medicare Patrol. If you are outside of the North Central Texas area, SHIP Help can help find benefits counselors in your area if you do have questions about Medicare, Medicaid, Social Security, advanced directives. In addition to that, we also have ombudsmen who advocate for residents in nursing facilities and assisted living facilities. We have workshops. Right now, I believe they're still virtual for chronic disease, self-management, diabetes, self-management, pain management, fall prevention, and those are all at no cost because of the funding we receive. So we do have many programs available for the community, and if you have questions, we are here to help you. Thank you.
Do you want to go ahead and advance it to the final one, which is just, and that's just really the same thing we just did. This just talks about next month.
Oop.
There we go.
There you go.
There you go. This is what's coming next month. Somebody said fall prevention, matter of balance is in person also at this point, Linda was saying. But thank you all for joining us. Melinda, thank you. Great job. And if anybody has any questions, they're more than welcome to send me or Melinda an email afterwards, and we'll try to get those answered for you. Thank you all for joining us. And we'll be, again, replaying the recording at 3 o'clock today. If you want to share that information with people you work with, you feel like you get some help out of this or get some good information, feel free to do that. If they just go online and register for this afternoon, they will get the link for that session. Thank you all, and y'all have a great day.
Thank you, Marty.
Thank you so much.